Hello everyone. Today we're going to talk about vaginal rejuvenation. There are thousands of products and procedure marketing to women to help them hold on to youth as long as they can. Vaginal rejuvenation is a broad term for vaginal corrective treatments. There isn't a single method for vaginal rejuvenation. There are creams and injections available to help with orgasm quality. There are another procedure and laser treatment that promise to tighten or enhance the appearance of the vaginal muscles. This video will catch your attention if you're a lady who wants to be more confident and seductive after childbirth. Our role today is to answer most of our questions regarding vaginal rejuvenation. Today we have Doctor Bae, who is a leading doctor at JK Plastic Surgery. He's going to discuss with us everything related to vaginal rejuvenation from an experienced medical point of view. Hi, I'm Queenie, and before we start, please subscribe to our channel so that next time you'll be updated with our new releases. Okay, so we are going to move on to vaginal tightening procedures. So can you tell us a little bit about vaginal tightening procedure?
Vaginal tightening is implemented when there's a problem either on the inside or the outside. First, about the inside. If the patient has gone through multiple pregnancies and vaginal deliveries, this weakens the vaginal wall. In some cases, the vaginal wall muscles are torn, and the introitus becomes stretched. In this case, problems may arise during sexual activity. By restructuring the overly stretched or aged genitalia as best as possible, patients and their partner can live a healthier and more satisfying life. Now, if we switch to the outside problems, aging causes vaginal tissue to stretch in the same way they cause our faces to become saggy. If lack of volume is the cause, we can fill it with the patient's own fat. And if the tissue stretching is a more serious problem, we can restructure it to a healthier and more ideal shape through simple surgery. I would like to point out that during intercourse, if the relevant tissue is too stretched, it could lead to a less satisfactory sexual experience. In addition, if the inner surface of the vagina is stretched or if the mucous membrane dries up, it can be uncomfortable for both parties involved. Thus, the benefit of our surgery and procedure lies in eliminating those problems to enable a healthier and happier life for the patient.
So who can benefit from this procedure?
This is recommended for couples who already have 1 or 2 children and have no further childbirth plan. It's also most sought out by these couples. Typically, women who belong to my age group, or the mid-40s, become less satisfied with sex due to the weakening and dried vaginal wall. This leads to less frequent intercourse between couples, which in turn can adversely affect the couple's relationship. Having a youthful face alone is not enough to sustain intimacy in a relationship. Maintaining your genital health can also help immensely. This is why patients in their 40s and 50s most commonly visit our hospital. Younger patients also visit our hospital before they get married for maintenance purposes or to reshape their vaginas in a more desirable way.
So how is vaginal rejuvenation performed?
There are largely 2 parts. The first is related to the external genitalia, and the other is related to the internal genitalia. The procedure on the external genitalia is mainly for aesthetic purposes. It includes either downsizing or reshaping the labia majora and minora, and there are cases where the clitoris is covered up with flesh. This can contribute to a relative insensitivity to sexual stimulus. We can also mend this problem. In addition, it is possible to improve the patient's sexual life satisfaction by sensitizing the erogenous areas of the genitalia. In respect to the internal genitalia, which is the vagina, treatment is performed largely in 2 ways. Indications include vaginal wall weakness, urinary incontinence, or vaginal dryness. The 2 treatment methods are surgical and non-surgical methods. The difference between the 2 lies in the preservation of the vaginal wall integrity. For example, when the vaginal wall is intact, that is, all the vaginal muscles are well connected, and there's no problem with the vestibular morphology, we utilize non-surgical methods such as radiofrequency ablation, HIFU therapy, and laser phototherapy to vitalize the mucous membrane and tighten the vaginal wall muscles. Vitalizing the mucous membrane can help increase its secretions. Another example would be when the structures surrounding the urethra are weakened and leaks with increased abdominal pressure. This can also be mended using non-surgical methods. However, if the condition has already progressed to a certain extent, so much that the perineal muscles have fused with the vaginal wall muscles, non-surgical methods are unwarranted. In such cases, a satisfactory result can only be achieved by connecting the stretched muscles and narrowing the introitus surgically. In short, if the condition has progressed, surgery is recommended. If not, non-surgical treatment can be chosen.
So what are the effects of the procedure?
As mentioned earlier, in respect to the external genitalia, the effect is mainly aesthetic. In addition, it can sensitize the erogenous area. Regarding the internal genitalia, vaginal wall tightening can improve the satisfaction of both parties during intercourse. Furthermore, the increased secretion from the mucous membrane can lubricate and reduce the friction.
So are there any complications after the procedure?
When surgical treatment is performed, tissues can become sensitive in the recovery process. Just like when we have a fresh scar on our body, it feels sensitive when we touch that spot. In addition, intercourse within a few days of surgery can delay the wound recovery. For example, if the vaginal wall is tightened using a surgical method, we advise against sexual activity for at least 4 to 6 weeks. And if we divert our attention too much to the appearance of the external genitalia, it may look pretty, but a larger surface area will come into contact with our clothes and make you uncomfortable. Instances such as when you exercise or wear clothes. So if you change the shape too much and go full Hollywood style, the shape can be improved, but your daily life becomes uncomfortable. Therefore, before surgery, it is important that the patient and the doctor have a sufficient conversation and determine the direction of the operation.
So is it possible to have natural childbirth after the procedure?
There's no problem at all when proceeding with the non-surgical method, and even when tightening the vaginal wall surgically. Given that the vaginal wall change was not excessive, it can regain compliance in the future to give childbirth. However, if the vaginal wall has been tightened too much through operation, problems can arise. As long as you don't step beyond the limit, both the surgical and non-surgical method do not become a problem for delivery. If you visit our clinic, we are ready to assess your condition accurately and balance out such expectations and the potential problems and risks.
So when can a patient start physical activity after the procedure?
If treatment is performed in a non-surgical method, patients can start exercising immediately. Since it is a procedure that is performed in a single day, you can go on with your daily life right away. In the case of choosing the surgical method, patients should avoid vigorous exercise for 2 weeks. This is because the remaining tension, especially on the external genitalia, is prone to damage during the excessive movement and stretching of this area. In particular, the thigh-wide open posture should be avoided for about a month after surgery because there is tension in the tissues around the genital area. Also, it is okay if you close your legs when you go to the bathroom, but if you spread your legs too much, there may be tension.
So that's it for today, Dr. Bae. Thank you so much for joining us today.
Thank you very much. It's a great pleasure.
감사합니다. So today we learned many things about vaginal rejuvenation, and the doctor explained in details everything related to this cosmetic procedure, such as its types and expected results. Thank you for joining us today once again at Classville TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.